mind. Okay? And are they better physically for you? Absolutely. So should you exercise? Yes. Is it going to make the delivery any easier? Absolutely not. Absolutely not. So I don't want to pretend for you that we're going to talk about that here in this class. This is not a let's pretend to have a baby class. Okay? So we're not going to get down on a mat on the floor and pretend to push. Because if you really use the muscles that you need to use to have a baby, you're going to pee on the floor, and you're going to poop on the floor. You're going to make a mess. You're going to embarrass you. We're not going to do it. Okay? You can't fake it. And I can tell you that the discomfort that you're going to feel when you have a baby is nothing like anything you've ever felt before. When you go into labor, you're going to say, oh my God, what is this? We're going to talk about it next week, I promise you. We're not going to keep any secrets. But any kind of exercises that you do, thinking that this is going to strengthen your muscles or make the delivery any easier, I think it's a psychological effect. So if you think it's going to work, do it. But will it really make any difference? I don't think so. Okay? That's my opinion. Yes?
I had a question regarding the two cervix, or when you have two vaginas. Mm-hmm. How do you know if you have it? Are you going to actually
I'll tell you.
Exam?
I'll tell you.
Okay.
When I examine a girl and I find that, I'm going to tell her. She needs to know. Somebody needs to tell her. Now, you know, the interesting thing is that almost always one of the vaginas is a little bit bigger than the other one. Okay? Because when you start having sex, he finds one side. You find one side, or you found one side when you started to put in tampons, and it just kept going up that one side. And the other side is usually a little bit smaller. I usually joke about it, and I say one side is for procreation, the other side is for recreation. But in fact, one side is almost always bigger than the other if the septum comes far down the vagina. Now, sometimes there's just a small septum, and it's well up inside the uterus. And I can see it, and I can feel it when I do the examination. And I can see it when I look in, and I can see that the cervix has some tissue protruding out from it. And there's one opening on one side and one on the other. And if I see that, will I tell you? Absolutely, I will. Sure. If I told you, if I didn't tell you, you don't have it. Okay? Because I would have told you, because there would be issues. There would be issues with how the pregnancy is going to develop. There would be issues with the delivery, and I'm going to tell you. There are no secrets. Okay? If I found that, I would tell you as soon as I found it, and we would confirm it by ultrasound or, you know, one thing or another. All right? We would get as best an idea we could about what the anatomy is. All right? So if you don't have it, if you don't know that you have it now, you don't have it. Okay?
I actually had a couple more questions.
Go ahead.
One of them is about ultrasound. Do you think the ultrasound affects the baby?
Not at all. Okay? Can you have many ultrasounds during pregnancy? And the answer is absolutely yes, you can. Have we found so far, today, 2007, have we found any ill effects to the baby from ultrasound? Not to my knowledge. So can you have repeated ultrasounds? The answer is yes. Do we do a lot of ultrasounds during pregnancy? Cumulatively, for everybody, yes, sure, we do. We do a lot. Each person usually gets 2, depending on when they've seen me in the pregnancy. If they come for the first time at 20 weeks, they're going to get an ultrasound around 20 weeks. They're going to have missed that first ultrasound, right? Do they need another one after that? The answer is no, they don't need it. Will they get one? And the answer is probably not. Probably not. It depends on whether there are issues. Am I happy about the growth of the baby? Does it feel too big? Does it feel too small? Is it diabetic? You know, we're going to talk about a lot of these issues. For instance, one of the issues that we'll talk about is when I examine you towards the end of the pregnancy, and you're at 38, 39 weeks, and I put my hands on and I say, whoa, this is a big baby. Is that an issue? I think it is. And we're going to talk about that because there are potential issues with the delivery. If I think, for instance, that your baby is 10 pounds, okay? If I think you're having a 10-pound baby, we're going to talk about whether this baby should be delivered by cesarean section or not. Should we even let you go into labor? Okay? We need to talk about that because there are certain complications that happen the bigger the baby gets. If I think the baby's a normal size, will we do an ultrasound? I'm sure we won't. And a lot of people will say, you know, I want an ultrasound. I want to see if the baby's okay. Is a normal ultrasound going to guarantee that the baby's okay? Absolutely not. If your baby's moving, if it's growing, we listen to the baby's heart. Do we really need to do an ultrasound? No, we don't. But do we do ultrasounds, for instance, on people that are in labor? Absolutely we do. Sometimes we're looking for presentation, sometimes we're looking for where the placenta is, sometimes someone walks in and we've never seen them before, and they're in labor, and she weighs 346 pounds, and you try to examine her, and you can't even tell she's pregnant, let alone where it is. 346 would be good. What about 446? And you've never seen her before, or you're on call, and somebody walks in and you don't have any information about her at all. You have no history, no information, and you need information. So sometimes an ultrasound is necessary. Sometimes we'll do it because we need to know where the placenta is. Sometimes we need to know about a placental separation. There are all kinds of issues as to why we do ultrasounds, and things that are called biophysical profiles. And we'll talk about that. A biophysical profile is a more detailed ultrasound, where we're looking at amount of amniotic fluid, we're looking at cord flow, we're looking at breathing movements, we're looking at how stiff the baby is, we're looking at tone. All of these are issues, and sometimes we'll do them, and it gives us good information. And if we get back, for instance, a biophysical profile that says, as an example, the score is 4 out of 8. And the 4 is because there's no amniotic fluid and the cord flow is poor. Is that an issue? Absolutely. And it might even say, you know what, go to the operating room and do a cesarean section. So there are issues. Okay?
What do you think about 3D ultrasound?
I think it's a gimmick. And if you want to go do it, go spend the money, it's okay. Does it harm the baby? Absolutely not. Will it eventually be the standard? Because right now it's two-dimensional. Will it eventually be the standard? Everybody will have 3D ultrasounds? Sure. But for right now, it's not the standard. And right now, it's a non-benefit of OHIP. You have to pay for it. And if you got the money to spend, go spend it. If you don't have,
is it worth it?
In my opinion, totally not. Totally not. So now your next question is, did my 2 girls have 3D ultrasounds? And the answer is yes, because the ultrasonographers just did a favor and just did it for the girls. They didn't charge them. But if they had to pay for it, would they have done it? Probably not. Okay? If they came to me, if my daughters came to me and said, Daddy, should I do a 3D ultrasound? I would say, don't bother. Okay? That's my answer. All right? Don't bother.
What about vitamins? You mentioned that vitamins are important. If you're taking Materna, do you need anything else?
No, you don't. Everybody should take early on in pregnancy folic acid. Everybody should take a milligram of folic acid, and the statistics show that people who have normal folic acid levels have a reduced incidence of spina bifida. They have a reduced incidence of nuchal translucency issues and all spinal problems. So reduced spina bifida. What happens? We close from right to left, okay? And spina bifida is an issue, and we'll talk about it a little bit later on in the 4th class when we talk about congenital anomalies. Later on, is folic acid as important? No, because most of us have folic acid stores, but we have limited iron stores, and a lot of girls come into pregnancy iron deficient, and it gets worse as they get along. So the iron is more important later on, but iron sometimes upsets your stomach, sometimes it makes you a little nauseous, some girls vomit with it, everybody gets constipated with it, so there are issues, but should you take it? And the answer is as best you can. Sure.
And my last question is, you know how when we come for your visit and you listen for the heartbeat, is there a machine that you can buy to hear at home for heartbeat? And is it necessary?
If you're Tom Cruise and you got zillions of dollars to spend, you can buy yourself an ultrasound machine. Is it worth it? No. The little Doptone that I use in the office is $795. The big ultrasound machines that they use in the ultrasonographers in the radiologist's office are about $250,000. There are little portable units that you can buy that are about $50,000. Do I have one in the office? No.
No, but Sears has some,
No.
kind of.
No. No. Because if you do that, what you're going to do is you're going to put a monitor in the baby's room, you're going to put a sound monitor in, you're going to put a video camera in there, and you're going to make yourself crazy. You're going to make yourself crazy. Don't make yourself crazy. Okay? Don't spend the money, please. Do not buy a Doptone. You're going to make everybody nuts. Because the minute you aren't able to find the baby, you're going to phone him. He's going to want you to come and see me. Don't do this. Okay? Other questions? Yes?
How does it feel when the baby moved the first time?
I don't know. But they tell me that it feels a little bit like maybe some gas or something, a little bubble or something just poking a little bit, something. I don't know. The answer is I don't know. But when are you going to feel your baby move for the first time? It's going to be around 22 weeks. If by 24 weeks you haven't felt that baby move, you're not paying attention because it's moving for sure. Okay? If we can listen to the heartbeat, is that baby moving? Absolutely. You're just not paying attention. And by 26, 28 weeks, you're going to come back and say, it's making me crazy. It's moving all the time. That's what will happen. Okay? So almost everybody feels the baby by around 22, 24 weeks. And then after that, it's just more and more and different each time. Okay? Other questions? Yes?
Can you just confirm, I understand that it is safe to take the prenatal vitamins throughout your pregnancy and even after?
And even after, absolutely. If you've still got some prenatal vitamins, and it doesn't matter what kind you've got, is it safe to take them afterwards? It's safe to take them anytime. Absolutely.
Okay.
Absolutely. And a lot of girls, after they have the baby, are iron deficient. Some girls go home with a really low hemoglobin. Once in a while, we need to transfuse people because their hemoglobin is so low. But again, that's going to be an issue we're going to talk about later on. But is it safe to take it? 100% for sure. If you've still got a bottle of them left after you've had the baby, finish it. Just keep going. Don't save it for the next pregnancy. Just finish it.
And also, you have advised me to be on baby aspirin. Is that safe to continue and necessary to continue?
Did we start out at the beginning of the pregnancy with progesterone suppositories?
Yes.
Yes. I probably put you on that because of recurrent miscarriages?
One.
And then we decided.
I have lupus.
Okay. There are sometimes clotting issues in pregnancy. Is it safe to take a baby aspirin all the way through the pregnancy? The answer is yes.
Okay.
So can you continue with it? Yes. And the progesterone suppositories we used up until about 12, 13 weeks and then we stopped. Agreed?
Yes.
And here we are.
Okay. Being on the baby aspirin, I realized that my blood is not flowing like it was, like when I go for blood tests. Can it also cause bruising to stay much longer than normal? They're not healing properly.
That might be more related to your lupus than to the baby aspirin. But next time we're in the office, you're going to show me the bruises.
Okay.
Okay? And we're going to talk about that. And maybe we'll do some clotting tests.
Okay.
And we'll see whether there are any issues. But usually a baby aspirin doesn't change your clotting factors one little bit. Okay?
Okay.
Usually it doesn't. And it may be more an issue of other things, especially the lupus. Okay? Because lupus is an issue.
Okay. One more?
Yes.
I understand that everybody's pretty much going to get some swelling, especially down in the ankle area.
You're getting your hands are swollen now too.
The hands just once they did, but the ankles, if one is a lot more than another, that could be a vascular issue, could it not? Or is that normal?
You know what? I think it's pretty normal. Okay? It's almost never a vascular issue. It's not, you know, that your veins are any different on one side than the other, unless there's perhaps a history of phlebitis, which there isn't.
Right.
So could it be an issue? The answer is almost for sure not.
Okay.
Almost for sure not.
So just keep the feet up above the hips and I should be fine.
You know what? Better to lie on your side. What happens when you lie on your back and you put your feet up is some of the fluid may drain from your ankles, but it's all going to collect in your butt. Okay? So it's going to pool. It's going to pool like this. So is there any point to it? Absolutely not. If you're going to lie down because of swelling issues, always lie down on your left side. Lie down on your side. Putting your feet up is not going to solve the problem. If I hang you upside down, your ankles are not going to be swollen. We're not going to look at your face. Okay? It's going to be like this, and your veins are going to be standing out like that. All right? We're humans, we're vertical. Right? If we get varicose veins, we wear pants. But if we turned ourselves upside down, can I get rid of your varicose veins on your legs? Sure. You've got to spend the whole pregnancy upside down. You want to know what your face and your neck are going to look like?
I don't want to.
You're going to have great big veins on here and great big veins there, and you can't wear a turtleneck all year, right?
So the only real cause for concern is if your hands and your face swell rapidly.
That may be an entirely different issue, and when we get a little bit later on to talking about preeclampsia and toxemia, then we have a whole different issue. And then we're going to talk about the type of swelling that we see with that. Because that's not just facial swelling, that's total body swelling. And total body means total body. That means your brain. It means your liver. It means all kinds of issues have occurred. And that's an entirely different swelling. The swelling that girls have in their ankles is just fluid coming out, and that's transitional. It comes in, it goes out. Sometimes your hands get a little bit swollen and you can't take your rings off. You can't move your rings. It's not unusual. And sometimes you'll get some numbness and tingling in your fingers. It's a carpal tunnel effect. As the nerves are passing through the sheath in your wrist, they're being compressed by fluid, and you get some numbness and tingling. That will disappear after the pregnancy, for sure. Are you going to be left with any residual effects? Highly unlikely. Highly unlikely. But the swelling,
Thoracic outlet syndrome.
yeah, well, there are issues, okay, and they're uncommon. But if you're looking at total body swelling, we're talking about toxemia, and now we're talking about an entirely different kettle of fish, okay?
Okay, thank
And
you.
we'll talk about that. Yes?
Are there any medications for colds and allergies that pregnant women can take, or none whatsoever?
You can take Tylenol with impunity, okay? Can you take Tylenol cold? Sure. Can you take off-the-shelf antihistamines? Probably yes, if you have any concerns at all. And sometimes I do. Make a phone call. You call Mother Risk, okay? Mother Risk is, we have a number at Sick Children's Hospital for a program called Mother Risk, and they will talk to you about any medication, whether it's safe or whether it's not safe in pregnancy. But by and large, can you use cold medicines? The answer is yes, okay? By and large. But most of the time, if you've got a cold, you wait it out. It's going to take but in pregnancy, it's going to take a little bit longer. You're going to be a little more congested. You're going to cough for a little bit longer, just because it's pregnancy. Is it an altered immune state? For sure, to an extent it is. Is that what's responsible? Probably not. A lot of the congestion is just from the increased amount of fluid. Will it take a little longer? Sure. Will it go away? Yes, it's a virus. Is there any point to taking antibiotics? Absolutely not. Yes?
How normal is to have constant headaches throughout the pregnancy?
It's not normal to have constant headaches. It's not unusual to have headaches. Constant headaches, I'm not sure what to tell you. You know, if it's a tension headache, you know, and it's stress related, whether it's your job or it's your husband or it's somebody else or something that's going on in the family, is that unusual? No. Is it normal to have a headache every single day? No. If I send you to a neurologist to investigate it, is he likely to find anything? Probably not. How often do we see young females, young, 30, 35 years old, 25 years old, with brain tumors? Pretty uncommon, okay? Pretty uncommon. Is it likely to be a vascular thing? You know, are you going to have a stroke? It's highly unlikely. Is it possible? Yes. And when we come to talk about toxemia, we're going to talk about headaches at that time and blurring of vision and things like that. But ordinary tension headaches, people get them all the time. You get a tension headache, take some Tylenol. Early on in pregnancy, you can take some Advil. There are issues with it perhaps later on. But early on, take some Tylenol. Getting headaches every day, it's pretty uncommon.
What if you get it? What if you get it 4 days out of 7? And
All the way
and
through.
You get it when you wake up. You just wake up and you have a headache.
Julia, I don't know what to tell you. I don't know what to tell you. It should go away with Tylenol. Is it likely that you have a brain tumor? It's highly unlikely. Okay?
But does it have to do anything with pregnancy?
Possibly. I can't tell you. If ordinarily while you were not pregnant you didn't get headaches, and now you are pregnant and you are getting headaches, I think it's stress and pregnancy related. Okay? Will it get better afterwards? Yes. And if you continue to have that type of headache after you have the baby, are we going to investigate it? 100% for sure. Are we going to find anything? Probably not, but I don't know.
But if it goes away after 10 mil, you're good. Right?
I think so. Okay? Yes?
Just a question about is like the sound, any kind of sound will affect the baby, like if you go to theater or concert or something, just...
No. If you go to a concert, go to a rock concert, is that going to affect the baby? Absolutely not. Okay? But can the baby hear? Yeah, probably. I mean, I can't tell you how many people play Mozart to their baby thinking that it's going to be a pianist afterwards, right? I can tell you that it's not, right? Being a pianist is a little bit of a gift from God and a lot of practice, okay? It's not about putting a radio on or putting a tape on and playing Chopin. That's not going to help the baby. Can the baby hear? I think the baby can hear. Absolutely, I think it can. And incidentally, we test hearing after the babies are born. They have a little acoustic vibrator and they test the baby's hearing. But is going to a rock concert going to harm the baby? Absolutely not. Okay? Yes?
What time of the pregnancy can you find out that you have a placenta previa?
That ultrasound that you had done at around 18 to 20 weeks is going to show us where the placenta is. The first ultrasound at 12 weeks is of no use for looking for the placenta. It's of use for the nuchal translucency and how far along you are in the pregnancy and how many babies are there. But the ultrasound that's done later on is going to give us an idea of where the placenta is. And it's going to say the placenta is, it might say placenta previa. And if it says that, you are for sure going to have more than one ultrasound during the pregnancy. For sure. And I'm going to talk to you about bleeding and not having sex and all kinds of things. And sometimes it'll say low-lying placenta or marginal placenta previa. Are you going to have more ultrasounds? Absolutely you are. Because we want to see that as that pregnancy is growing, that the placenta gets dragged up out of the way. Okay? But if it's in the normal position at 20 weeks, do you have any concerns about placenta previa? Zero. Now, having said that, there are, again, no absolutes in medicine. There are no nevers, and there are no always. The placenta, once in a while, is not in one piece. Okay? Because all of you think that the placenta is in one piece. There's one placenta. Once in a while, there's another little piece of placenta. It's called a subcenturiate lobe. And it may be even this big. And it may not be visible on an ultrasound. Here's your normal placenta. It's up here on the side. And right down there where it's not supposed to be is a little piece of placenta. How often does that happen? Not very often. But can it happen? Yes. Is it an issue? Yeah, it is, because you're not expecting it. It's a surprise. So once in a while we see abnormalities. We see weird things. And there are issues because there are vessels that are connecting those two placentas. Here's this little piece here. Here's the big piece over here, and there are vessels connecting the two. These are called vasa previa. These are little blood vessels that are running in the membranes. And if they tear, can they cause a problem? Yes. So there are issues. Sometimes when a girl is bleeding and she's in labor, and we're saying, is this the normal amount of bleeding? Is this just what we call show? Or is this more than that? Is there an issue there? So can that happen? Yes. Is it common? It's extremely uncommon. Okay? But sometimes we'll deliver the placenta afterwards, and along with the membranes and the placenta comes out another piece of placenta like this, called a subcenturiate lobe. And we look at it and we call everybody over and we say, hey, look at this. Did it make any difference during the pregnancy? Not. How often does it make a difference? Extremely uncommonly. Okay? Sometimes when we do the delivery and the placenta comes out, a little piece of placenta stays behind. Is that an issue? Yes.
That was my next question.
Yes. Do we need to deal with that? We do. Sometimes it comes out a day later. And we say, wow, another little piece of placenta. It's a good thing it came out. Because you're surprised. Most of the time the placenta comes out by itself. And sometimes even if you have to put your hand up inside and fish out the placenta, can you miss a little piece?
Sorry. You just like fish it out.
Yeah, well, that's class number 3. What if the placenta doesn't come out? Remember I said, what if?
I wasn't expecting. I was expecting it near the end.
Well, there you go. There's another little piece of placenta in there, and you can miss it. You can put your hand up inside and miss it completely. And sometimes you put your hand up inside and there's a little piece and you pull it out afterwards and you say, good, I'm glad I got it. But you got it by good luck, not because you were smart. You just got it because of good luck, that's all.
I'm just curious about sex during pregnancy.
Sure you are.
Yeah.
I would be too.
Does the sperm enter the uterus or affect the uterus?
Absolutely not. There's a sac. The baby is inside a sac, and the mucus that's in the cervix prevents anything from going up inside. Remember I said that after day 15, the mucus blocks the cervix and it stays there through the pregnancy. The sperm don't go anywhere. And the baby's inside a sac. It's completely protected. Okay? It's protected from bacteria, viruses. You know, there are issues. There are issues. Remember, this is, you know, by and large, this is Obstetrics 101. Some parts of this are not Obstetrics 101. They're going to be Obstetrics 301 or 401. But I'm not teaching a medical class, right? And we're not going to go into detail. This is not like me presenting rounds. And we're going to talk about medical issues that are going to be important. What we're doing is we're talking about surface issues. Otherwise, we would be here for 4 years. Okay? A residency, an obstetrical residency, is 4 years long. Okay? With medicine and surgery thrown in too. Want to stay here for 4 years? I don't think so. Other questions? Yes?
I'm about 20 weeks along and I'm still taking the morning sickness medicine. Is that normal?
No. The answer is by and large, no. But do I have some girls who throw up throughout the whole pregnancy and feel nauseated throughout the whole pregnancy? The answer is yes, we do. Okay, so is it normal to still be throwing up at 20 weeks? I would say it's not. But it's not pathological either. It becomes pathological when you're vomiting constantly, when you're not holding anything down and we need to bring you into hospital and put in an intravenous or, you know, or worse. If you're throwing up once in a while or you're feeling nauseous and you're 20 weeks, bad luck. It's just plain bad luck. And if the medication that we give you helps, that's great. And if it doesn't help, we're going to have to suck it up as best we can. As long as you're not throwing up to the point where you're losing weight, or you're dehydrated, or you're really sick, you know, and you're vomiting maybe once or twice, or you're spitting up. You know, I have some girls who spit up throughout the whole pregnancy. They walk around with a cup.
So should I stop taking it?
Is it helping you?
Very much so.
Don't stop.
Okay.
It's not going to harm you at all. Okay? But if the answer is it's helping you, absolutely continue. But there are some girls who walk into my office and one of the things they have is a pile of Kleenex and a cup, and they're constantly spitting into the cup. Constantly, the whole pregnancy, it doesn't stop. Is it an issue for them? Yeah. Can I get it to stop? No. Weird things happen to girls during pregnancy. I have some girls who eat mud. They come in and they have a little jar of dirt. And they have this incredible urge to eat dirt. It's a pica. It's not like eating sour pickles. Right? I think the sour pickles, it's not about the pickles, it's about the salt. Right? Some girls have a salt craving during pregnancy. They absolutely crave salt. They're looking for something to lick. And here's something here's my pager. There's something that they don't have to lick. It's a pickle. They're not really interested in the pickle, they're interested in the juice, the brine. If they could get away with drinking it, it would be perfect. Okay? Weird things happen. Other questions? Okay, I'm dehydrated. We've been talking now for 3 hours. When we talk next day, and we're going to meet 10 o'clock next week, okay, on time, I want everybody to come. We're going to pick it up from that point and we're going to start talking about labor. We're going to talk about issues with labor. How am I going to go into labor? What's it going to be like? What should I expect? What's normal labor? What's not normal labor? How do we make you go into labor? How do we try to stop you from going into labor? Can we stop you? What if you go into labor and we can't stop you? What if it's too early? What if I need to induce you? All these kind of issues. So we're going to talk about labor. And we're going to talk about pain relief. Because you've heard, I think, that labor hurts. And I promise you, it hurts. There are very few girls who smile all the way through labor. There are some. They are unusual. Let me tell you. So we're going to talk about pain relief and all of the issues related to that. And we'll talk specifically about epidurals, what's safe, what's not safe, should you, shouldn't you, what are the issues about it. And I'm not going to hold back. Okay? There are some people who say don't have an epidural. And there are other people who say, I want one the minute I walk through the door, here's my back, stick it in, I'm not even taking my clothes off. So we're going to talk about all of those issues. I promise you, I'm not going to leave anything out. Okay? Is that fair? All right. So we'll see everybody next week, same time. Okay? Good. All right.